So the process here is really we'll go through a range of different, we'll go through it in terms of the conditions that are concerning you, and we've already started talking about your joints and stuff, so we can start there. Look at the medications you're using for treating that particular condition, and get a feel for how effective you think that is, and any problems you think you're getting from those. So starting then with the Sjogren's, which you've just told me took a little while to get diagnosed because of the symptoms being a bit diffuse. They put you then on the Plaquenil.
Yes.
And has that been for some time then? You've been on the Plaquenil?
Yes.
Years?
Before the Plaquenil, there were various other things that were tried, but the Plaquenil has probably been about 7 or 8 years. Okay, so you've had
7 or 8 years of Plaquenil. So in that time, do you feel that's improved things, or is that basically the same as it's always been, or?
It slightly has improved things.
Okay. And so how often do you see your rheumatology specialist?
Every month or 3 months.
Okay. All right.
Depends on how the flare-ups are going.
Right.
If I'm having a really difficult time, then she wants to see me more often. Okay,
and does she change your medicines at that time? She gives you some other medication?
Yes, she does.
Some prednisolone or something like that?
I had about 15 years on prednisolone.
Right. So are you on a maintenance? Do you take some regularly now, or is it just for the flare-ups?
I have it for flare-ups only, because I prefer not to take it.
Yeah, well, obviously but it's one of the ones that works so well. So that's obviously and so whenever you have a flare-up, you have to have some, and then you have to gradually get off it.
For 5 days.
Okay.
And then
so when was the last time you had a course of prednisolone for a flare-up?
Earlier in this year.
Okay, so it's about
April, May.
April, May, okay.
Yes.
So that means you've had maybe 4 or 5 months, or 5 or 6 months without a flare-up. So that's pretty good.
Well, I have had the flare-ups, but
not bad enough to.
Yes, we've tried other things.
Okay. So what other things have you tried in those for these recent flare-ups other than the prednisolone?
We went on to the Panadine Osteo.
Yep.
And before that I had big doses of Panamax.
Okay.
And some other drugs that...
Yeah. That's okay. So basically painkillers.
Yes, I've had all of the anti-inflammatory drugs that are around. Basically, at one time or another.
So you tried things like naproxen and brufen and Feldene, those sorts of things. So you take any of those style? It doesn't seem like you're taking any of those style of drugs now.
I'm not.
Right? Is that because of your stomach issues? Right.
Yes.
Okay. Right. Okay. So you really can't take those because of that. Okay. All right. So in terms of your, so just cross that one off. So in terms of your sort of management of your Sjogren's, at the moment the only long-term drug you're on for that, other than the pain for the joints and stuff, which we'll talk about in a minute, is the Plaquenil. Is that right?
And the patches.
Oh yeah, the patches was for your pain. So Norspan is part of it is what the Plaquenil does is actually slow down the progression of the disease. It sort of doesn't really help on the day-to-day sort of pain sort of stuff, but it's a long-term thing. So for the day-to-day pain, that's where you start to have the patches and the Panadol Osteo that you talked about.
And the patches go up and down in...
So sometimes you have the 5, sometimes you have the 10s, or you're on 15?
Yeah.
Okay, right, okay. And how do they... So when they're at the right dose, are they controlling your pain, or...?
They certainly do help.
Yeah.
Yes. There doesn't seem to be any actual control.
Okay. So you've always got some.
I've always got some pain.
And if you have an acute event, like something, or that you need to have some pain relief, like short acting, do you have anything that you could take in addition to that, or?
Usually it's prednisolone.
Right. So if you had just like extra pain today,
yes,
you
well,
wouldn't take anything. Have you got anything that you use?
I would readjust some of my tablets, and instead of taking the 6 Panadine Osteo a day, I would swap some of them for Panadine Forte.
Right, so you do have the odd Panadine Forte if you need to as well.
Yes.
And do you find that helps?
Yes.
Right. Okay. So the Panadine Forte helps, the Tramol helps. Okay.
The Panadine Forte helps because if I'm taking that all the time,
yep,
then after a while it doesn't help.
Right, so
but
you keep it for sort of...
Yes, yep, an emergency type thing.
Okay. Okay, it still seems like we could improve that a bit though. So with the patches, you say you're sometimes you fluctuate on which dose that you have. At the moment, how much you...
I'm on a 5 and a 10.
So 15
yes.
At the moment.
Yes.
And that's once a week.
I change them over once a week.
Yeah. Okay. And in terms of your tablets that you're taking then, so obviously taking 6 a day of your Panadol Osteo and 2 a day of your Tramol. In fact, you take 2, 1.5. So it's a lot of tablets to take. Has the doctor ever tried any of the other anything stronger than Tramol? Have you ever had something called Endone or OxyContin?
Yes, I've had Endone.
Yeah.
I've found that to be really good short term.
Yep.
But my body seems to get used to whatever it's taking.
Yep.
And after a couple of weeks of the Endone, it was like, oh yes.
So the Endone you were taking was what, 3-4 times a day or twice?
Yes, every 4 hours.
Right. Okay.
Yes.
Right. There's a tablet of Endone with the Endone ingredient that's a slow release one that you only have to take twice a day.
All right.
Which is a bit stronger than the Tramol and would probably combine the benefits of the Tramol and the Panadine Forte in the one tablet.
Yes.
And it's just one tablet, that's the other advantage, you know, so you're not mucking around with all these 6 of these and 4 of them and whatever. The other option is that there are, in fact, even, you know, stronger patches. There are other patches that we could talk about, but I think the first thing we'll try and do is just stop that end of dose thing.
I have had up to 30
okay.
patches.
Okay, the next group of... So does that sound like a reasonable plan? We'll talk to your doctor about... well, first we'll write to them and we'll have a report and then we'll discuss it with them over the phone. But we'll talk to them about shortening the duration of your patch and looking at changing to a sort of stronger pain reliever that will get rid of the Tramol. Because one of the issues with the Tramol is it does, you've already mentioned that it wears off.
Yes.
And a number of the medications do that. The other thing is Tramol does have a number of sort of interactions with other medications that sometimes, you know, don't... it just makes it a complicated medication. It's a relatively new medication, so we'd be better off using something that we're a bit more familiar with.
Throughout the time when I've started on the different medications, for a period, the first beginning, you think, oh wow, this is working.
Yeah.
It seems to work, and then after you've been on it for a few months, the body seems as though it says...
Is that with most of your medications, or is that just your pain medication? Or
strangely enough, with most medications.
Yeah. Okay. Yeah. No, that's...
My specialist sort of says the body's laughing at what we're trying to do.
Yeah, well, it does change a lot. So, in with regard to those the Sjogren's and your joints, your main affected joints, are they?
The back.
Back, yeah.
Back, the knees. I've had the one knee replacement. Okay. And I'm due to have the other one done.
Okay, so you've had your left done. This is the right one coming up.
I've had the right one done. Okay. And the left one
coming up.
is coming up.
Okay.
But at the moment there's serious talk about back surgery. Right. Okay. Which we're hoping not to do.
Well, I mean, the surgery sometimes assists with the mobility and the pain and that sort of thing. So it's always a balancing act. Every surgery's got a risk, obviously, but you've got to weigh that up against the potential benefit, and talking to your surgeon about what difference it would make before and after in terms of how much mobility you might have and how much less pain you might have. I mean, obviously it's a personal decision, but they wouldn't be recommending surgery if they didn't think it would help you. Okay, look, you mentioned that one of the reasons why you couldn't take some types of medications was about your stomach problems.
Yes.
So you've had some reflux issues.
Yes.
So you got some Nexium. What else you got here?
There are two.
Oh, and the ranitidine.
That's
so you're on
yes.
Nexium and ranitidine.
Yes.
Okay, so you're having them both twice a day. This one here.
Yes.
So Nexium's twice a day and the Rani's twice a
Yes.
day. Okay.
I've only been trying the extra one for about 2 months.
Okay. No difference?
No.
You're shaking your head,
No.
can't see? Okay.
No.
So describe I mean, is that there all the time, or is it only when you lay down?
No, it's generally first thing in the morning.
Yeah.
Even a cup of tea,
Yeah.
just black tea,
Sets it off.
sets it off.
Okay.
And I only have, some mornings I might just have some fruit, stewed apple,
Yeah.
and that can seriously set it off.
Okay.
And it presents in making me feel really ill, plus the burping noise.
So you actually feel the reflux? You
Oh
actually feel it
yes,
coming
the
up?
burning.
So
And
with regard to, you're able to swallow okay? Is it, or is it affecting your swallowing? Or?
I have to chew things very, very slowly, and I can't swallow big amounts. I have to really make sure the food's small.
Has your GP ever tried any other medications for your stomach issues? Something called Maxilon maybe?
Oh
or
yes.
something like that? Tried
yes. Tried Maxilon,
that?
yes.
Yes?
Yes.
And was no...
No.
Okay.
No.
Motilium, has you ever tried that one?
I don't know that
Don't
one.
know that one? Okay.
No.
Alright. I mean, basically with the reflux there's a couple of things. One thing to try and improve it is to sometimes increase the emptying of your stomach a bit faster. And Maxilon does that a bit. This other one I was telling you about, Motilium, also helps with that. And so that might just take a bit of pressure off the top of your stomach, which is where the reflux is occurring. So that might be something.
I am having a gastroscopy on next week.
Right, that was the next thing I was going to ask.
Yes.
Is what are they doing about investigating it?
Yes.
Okay, so they're going to put a scope down and see what
Is
it's like.
going on.
Okay, all right. I mean, it
Because-
sounds like from your description, it's fairly obvious what's going on. You're getting reflux up there. You may have sometimes people have what's called a hernia
Yes.
in there, and that allows the liquids to come up a bit more easily than it should.
And kind of an acid burning.
Yeah, that's right. Yeah.
Sometimes when I even drink just a cup of tea, I can feel it burning down
On the way down.
on the way down.
Okay. All right. So gastroscopy. That's just next week, did you say?
Yes.
Or, that's right. Okay.
Next week.
Okay. Okay. So that might help. The other thing is your breathing, I suppose. You've got a history of asthma.
Yes.
And how's your breathing been of late? At the moment, you're using, so that's Ceravent and Medscope. Okay. And how are they going with your breathing then? Do you find they help? Or?
I also find that weather conditions,
Yep.
I'm inclined to have more attacks when it's really humid and there's not clear air.
Yep.
I'll have more attacks, and naturally if there are any smoke or fires
Yep.
around, yes.
So when you have an attack, what do you do?
Usually I'll have this one
Yep.
for just if I feel I can't breathe.
Yep. Yep.
I'll use this one,
Okay.
and I use this one 2 puffs in the morning.
Yep.
Every morning.
Every morning.
Yes.
Okay. So it's just once a day for that one.
Yes.
Okay.
This one as often as needed.
Yeah, of course. Yeah, that's what's
Preventative.
That's the reliever,
Oh.
and this is the preventer. So what that
Oh,
means
okay.
is this is one that will,
Anyway.
if you have an acute event, you can have up to 4 or even 8 of these puffs
Mm.
for an acute asthma attack. This is more the regular sort of long-term cover. Usually it's unusual to use this one by itself, but if the specialist has suggested it, I might get in touch with him and see why he's thinking just by itself, because there's probably some advantages to using a thing called Seratide. Have you ever had one of these that's purple instead of green? Like this? Looks exactly the same effectively.
Yes, I think I have. I have had another colour one.
Yeah? Okay.
Yeah.
So the reason you stopped the purple one was because of the mouth ulcers,
Yes.
and even with a spacer with a different device that still didn't work. So that the respiratory specialist basically says that's as much as we can use at the moment.
Mm-hmm.
Okay. All right. So that's the breathing. So how would you rate your breathing now? You're quite happy with the control of your asthma?
Yes.
You're getting attacks? How often are you getting attacks? Or
Well, at the moment, only every few days.
okay.
It's quite good, really.
And they go away quickly with the
Yes.
Ventolin?
Yes.
Okay. All right.
Weather changes
Yeah.
when it starts to get warmer.
Okay. So how often would you be using? Based on every few days, you'd be using your Ventolin every few days?
Yes. At the moment, I wouldn't need to use that daily.
Right. Every second day, every third day, twice a week?
Third.
Every third day?
Yes.
Okay.
Yes.
All right. And usually just 1 or 2 puffs, or?
Yes.
Yeah. Okay. All
When
right.
it's extreme, well then I'm using it every couple of hours and sometimes 2 or 3 puffs.
Okay.
Yes.
All right. You said you've got high cholesterol at one stage as well.
Yes.
So you're still on. What are you on for the high cholesterol? You're using.
I think
That's
that
a
they
good point.
I
They tested it and
yes,
they didn't.
she didn't do anything about it.
Okay.
I was on a cholesterol medication
Okay.
because it went up fairly high
Okay.
and then it came right back down again and it stabilised, and so
And then they stopped it, or?
and they stopped it,
Okay.
and then on a couple of weeks ago I was retested again and it was high.
Okay.
Gone up to about 7.
Yeah.
Blood pressure's actually quite good at the moment.
Yeah. The last
But
couple that were here
yes.
were all not bad.
Yeah.
So you
But
say
then-
at the moment, so it has been.
It just suddenly will have a high reading for no obvious reason.
Yeah. Yeah, that's the difficulty with treating blood pressure, because you know, if it was always high, obviously you treat it. But if it's only high now and then, if you treat it too aggressively, you actually end up with low blood pressure, and that can make you
Yes.
dizzy and all sorts of
Yes,
things. You
I
feel
had that
awful. So that's not. So that doesn't seem to be a major issue at the moment.
No, that's
And then we've got she's got down here insomnia or lack of sleep. Is that? Can you tell me about that? Do you have trouble going to sleep?
yes,
or?
I just really can't go to sleep.
Okay.
I can be really, really tired,
Yep.
and by the time you prepare for bed and get
Yep.
into bed,
Yep.
I can't go to sleep.
And is that because you've got concerns on your mind?
No,
or is that,
no. I try all the relaxation techniques,
Yep.
and I just can't go to sleep.
So I noticed he's got you down for some sleeping tablets and
Yes.
clonazepam. Do they help? Or?
They help to relax me, and
Okay.
and I do get off to sleep. And
Okay.
since I've been taking the clonazepam, I have been sleeping a lot better.
Okay. So you've only been taking that for a while, or?
Yes, 3 months.
Okay. And so in the last 3 months you've had a slightly better
Good,
experience?
good
Okay.
sleeps.
Okay,
Yes.
all right, that's good. Can't argue with that then, if that's been working well. Good. And so part of that, they've got you on Lovan. How long have you been on the Lovan for? Has that been a long-term thing, or?
Long term.
Yeah.
Mm.
Okay. So always that particular medication?
No, I think that's been changed.
Yeah. So this one at the moment, how's that been helping? Is that I mean, if your sleep's improved, that's one good sign. That's part of that.
Yes, I think that's working all right.
Okay, so they've got you down for Lasix tablets or frusemide fluid tablets at the moment. Is that because you've been getting some
huge swelling, fluid swellings in the ankles,
and
in the lower parts of the leg,
right,
and even in the fingers.
right, okay.
Fingers get a lot of.
So has that been helping, or is that?
When I first started taking it,
Yep.
I thought, yes, this is great because I was passing a lot of fluid.
Yep.
But it seems to have eased off again now.
Okay.
And the swelling's still there in my feet and ankles.
Right. Okay. All right. And you've got because you're on the frusemide, they put you on some potassium supplements. Okay.
That's right.
All right. And they took some. Have they taken blood tests off you recently, or
yes?
Just
about 3 weeks ago.
okay. Okay. I might talk to the doctor about getting a copy of those before I write up the full report, but that shouldn't be too much of a hassle. Okay. One of the last few things is your skin, various creams and things. The stuff that you're putting on your skin. Is that been a long-term dermatitis? Is that
no, it really started last year.
Yep.
I'd had a few spots before,
but
last year we came home from overseas and the weather was very hot over there.
Yep.
And I came out in this really red rash all over.
Yep.
And when I came home, we came into summer here.
Right.
And so it got worse and worse.
Okay.
So I was sent along to the specialist.
Okay.
And he said that it appeared, he diagnosed it as a lupus rash.
Oh, really? Okay.
Yes.
So but you said it was all over your body, did you?
Yes,
Not just on the face?
No, my back, my arms, my chest, and all over.
All right.
And very, very itchy. So he gave me the Elicum cream, which did clear it all up, but strangely enough, because the sun's been out again, I've got a few spots coming back on my chest.
So the other medications, this is the Cellular-Fresh. So then there's the management of your eyes because of the dry eyes from the thing. So you use the Cellular-Fresh eye drops, which you've got there.
Yeah, yes. I use those sometimes 2 or 3 times a day.
Okay. They've got down Movicol. How's your bowels with all that and all those painkillers and stuff? Are they
terrible?
Terrible. So
yes.
More constipated than the other way?
Yes.
Okay. Right.
And I take up to 3 sachets of Movicol.
Of Movicol, yep.
And no results.
Okay. All right. So, have you tried other things in the past? You ever had a thing called Coloxal or?
I have had Coloxal and something that's little black pebbles.
Oh, right. Coloxal with Senna, were they? Or?
I've got Senna at the moment as well.
Right, okay. So you're using the Senna at the moment?
Yes.
And that's working?
Well, it's, yes.
Okay.
Yes.
Because I mean, you're on quite a bit of the Tremol.
I'm taking actually more than the bottle says to take.
Okay.
But
and they've also got down here Magnin. Is that for leg cramps or something?
Leg cramps.
Do you use those at all? Or?
I was, but the leg cramp seems to have settled down.
Okay.
Because it was only ever in the one leg, on the side of the leg.
The one where you had the replacement?
No, the other one.
The other one?
Yes.
Okay.
And mainly wake up at night with the cramp in the side of the leg.
Yep. Then I noticed they put you on vitamin D as well, the catalyst for that.
Very low reading.
So one specialist is telling you to cover up and the other one's probably saying go out and get some sunshine to get the vitamin D up. Yeah.
And when I explained that I couldn't go out in the sun, my reading was only about 35.
Yep, okay.
So
it's alright, mine was 40.
Was it? Yes.
And I'm outside every weekend, so I think it's the location we're in terms of that.
I think so.
Yeah. So the Phenergan that was there, that was also for part of for the rash and the itch. Yeah. Mm. And so you're still taking those?
No.
No, that's not.
Yeah. That's just as required.
Yeah. So if that rash flares.
Mm.
And you're still using the Avestin badge cream?
Yes.
Yes? Twice a week or something like that? Or once or twice a week?
I was using it daily,
Yeah.
but I don't really get any relief
Yeah. Okay.
from it.
Alright. So again, that's all part of the Sjogren's. It all goes together with the drying effect of that. So you've been using it up to daily and it didn't help?
No, every night I would use it, but I just realised that I'm really not getting anything from it, so it's there, but I haven't used it.
Okay. There's a number of different things that we'll probably talk to the doctor about. Primarily your pain management, and also perhaps modifying what's going on with some of your asthma medications. So I'm not sure when you're seeing the doctor next.
Tuesday week.
Tuesday week, okay.
Yes.
So even if I get it to them next week, they'll still have something. So she'll have the report with her at the time.
Right.
So you'll be able to discuss the sort of things we've talked about.
Yes.
And say, Peter suggested this for my pain, what do you reckon? And she might say, well, look, yeah, we've tried that before, or, I don't want to do that yet, or whatever. But she'll be able to explain to you why she's, not doing it, if she's not going to do it, or why she's going to try it, or whatever.
Yes.
So she'll have that in front of her. So, that should work.
Yes.
Hopefully well. So Tuesday week, okay.
Yes.
Just make sure that it gets there before then, so that when you see her, she's got it. Okay. So that's basically it.
Yes. Well,
thank you for
thank
that.
you very
Sorry
much.
for testing your memory so much, but makes it much more useful if we